Hello and welcome to this week's Clarity Parent Chat. The topic we're going to discuss today is the benefits of setting clear boundaries at home for children. My name is Gerard Mijon. I'm with the Clarity Child Guidance Center, and we look forward to an engaging conversation with our speaker, Dr. Megan Lawson. For those who are not familiar with our organization, Clarity Child Guidance Center is a nonprofit treatment center solely dedicated to helping children 3 to 17 with their mental health. Clarity is located in the San Antonio Medical Center and provides inpatient and outpatient services to several thousand children every year. You can read more about the center at Clarity CGC and about children's mental health on our prevention and education website, oneinfiveminds.org. Before we start, I want to specify a few technical details. The webinar will end at 11:30, including a 10-minute Q&A at the end. This talk is recorded, but none of the names of the attendees will show in the recording to protect your privacy. And that's also why we are not taking live questions. However, if you have any questions for Dr. Lawson, we invite you to post them in the chat space at any time during the talk. Of course, this event is purely educational and is by no means an attempt to provide counseling online. Dr. Lawson is a psychologist who provides outpatient individual therapy and family therapy at Clarity since 2018. She helps patients with a variety of concerns and runs a trauma group for teen girls as well. She's also the mother of two young children, 3 and 6. She's joining us from her office on our campus. And Dr. Lawson, welcome.
Hi, thanks for having me, Gerard.
We have a lot of questions to cover because this is a big topic. So my first question is, when we speak about relationship boundaries, what do we mean?
Great question. So as a construct, a boundary in a relationship is really anything that's going to set a limit or mark a limit. And so in relationships, they're really psychological limits. So what we're willing and or unwilling to tolerate.
Okay.
And if we think about the boundaries as kind of on a continuum, like with most things, you know, there's healthy and then there's kind of unhealthy, and those can range. And most of the time, I mean, most humans aren't perfect at setting perfect, clear boundaries all the time. You know, most of us kind of wax and wane, and depending on what's going on in our own lives and depending on kind of our stress levels. But the goal is really to kind of stay within the realm of healthy boundaries, especially when we're talking about our relationship with our kids.
Sure. So if you think of a few concrete examples of boundaries that, exemplify what you said, the more critical or the less critical ones.
Yeah, so some concrete examples of boundaries. I mean, if we think about it, and I know this has really been impacted by COVID, and I'm sure we'll get into that, but space is a big one. So space, like how close we are to each other, where we do certain tasks. And time is a big one. When we do certain things, what time is bedtime? What time is nap time? What time is school time? What time is friend or family time or gaming time? Tasks is a big one. So when am I kind of doing my work versus being a parent? When am I taking care of myself? When am I, for kids, when am I doing school versus online gaming and trying to like pretend I'm paying attention? These are all examples of different kinds of domains that boundaries show up in. So space, time, tasks. And then for kids, there's different school boundaries and family, interpersonal, and different boundaries like that as well.
Yeah, and I discussed or speak about the space and time. I can see the cultural differences as well are very important. I have a French heritage, so I know that the way we interpret and think of those boundaries is quite different from other cultures.
Yeah.
And so that's also something that comes in play. Now,
of course.
You mentioned COVID. Yes. Why is it so important to maintain boundaries during COVID?
Well, for one, when COVID hit, and I don't know if this is true for you, it's certainly true for me. It's like our life, if we think about it like as a Venn diagram of like work, parenting, and then kind of like self-care or other relationships, or even if we're in marriages or romantic relationships, they all sort of kind of got blended together because, school got pulled and now everything's virtual. And so everything kind of mixed, and now my home is a school, and my home is my work, and my home is my place where I exercise because the gym's closed. So that boundary kind of got shaken up. And then for kids too, they're doing online programming, which for a lot of them, especially the youngsters, they haven't used computers before. So now everything is just really changed. And so COVID really stripped away a lot of the inherent boundaries that we had in our lives. Like, oh, we go to school and that's when we do school. And then I go to work and that's when I see my patients. And so when those got stripped away from us, I think there was this sense of anxiety on top of the anxiety around the virus, but it just kind of led us all to sort of like a collective regression, like what's going on, when do I do what, and who am I when, and am I a mom or am I a teacher? And so all of those things kind of got stripped away. So slowly, I know there was like the initial shock, but slowly it's been important, at least for me, and I think for my clients and for others as well, to slowly kind of implement boundaries and structure into our daily routine, because it really helps us to feel safe, and keep us kind of psychologically intact.
Yeah, it's like we had a structure in our life, and the structure
Right.
kind of went away, and everything we did just became too compacted into one location and
Exactly.
one time span, and now we have to rethink all that.
Exactly. And so, yeah, we had to rethink all that and decide, like, okay, how are we going to do this? And part of it is we've had to be, I think all of us have had to be a lot more flexible with our boundaries.
Yeah.
Because, the reality is, if we're trying to help our kids at home, but we're also trying to get work done, there's just no way to do that perfectly, and there's no great solution. So part of it is we're all doing the best we can. And I really believe that, we're all in this kind of together. And this is the first time, at least in several years, that many, many years, that anything like this has happened. So we're all doing it for the first time.
Yeah. Now, regardless of COVID, there is always are often struggles with boundaries. Can you give us some examples of in which families are struggling with boundaries?
Yeah, so boundary, I think we should maybe talk about, like, when we talk about struggles with boundaries, the way it shows up. So when we talk about healthy boundaries, it means, my expectations are clear. I can identify my own limits and why I have them. And I can explain it to my kids or my partner, or whatever the reason that they're there and why they're important. And then I can kind of uphold them whenever they're being crossed, flexibly, of course. So whenever we get into the unhealthy realm, usually we talk about that as either overly porous, which is kind of just like it sounds. Those are people, and my fault, honestly, whenever I get into the more unhealthy continuum, is I can become more porous in my boundaries. And so it's something I have to know about myself and really work on. But a porous boundary looks like someone who, is more likely to give in or unlikely to say no. There's a proneness towards overly enmeshment, or just kind of feeling responsible for other people's behavior. And so on one end, there's the porous boundaries, and that can be just as damaging as some of the very rigid boundaries. And so really rigid boundaries are, this is it, this is the way it has to be, no questions asked, you do what I say because I'm the parent. And those are a little bit overly strong, especially when that's all that there is, because there's really no room for the relationship or discussion. And it's just really harder it's not as connected. It's just the rules without the relationship. And so when we talk about unhealthy boundaries, some of what we're talking about is overly rigid or overly porous. And so some concrete ways that I'm seeing that show up, and again, like, without judgment, because I get it, our structure was ripped away. And so we all gravitate towards different kinds of pulls whenever we structure. But some of the ways I'm seeing it especially is with kind of like bedtime routines or sleeping. And so when school got pulled, I'm seeing a lot of kids who are staying up very late or even all night. And because they figured out ways to kind of like sign on and get some schoolwork done, later in the day, or they just have to sign on. They don't really have to be as present as normal. So a lot of like porous boundaries around sleep routine and sleep schedules. Yeah. So, and then I think there's been some rigid boundaries too. I've seen a lot of like, I know that some schools are going back in person and some aren't, and some families are doing these hybrids, and everyone's really trying to do the best they can. But I've also seen a lot of families that where parents, and of course, sometimes it's out of necessity, and I think that's a different conversation. But sometimes the overly rigid, the way it's looking is like, well, they're going back because I said so, or they're, it's just that's the way it has to be, but there's not really a conversation. And so then kids feel really upset and aren't able to share their feelings of upset over things.
Now, children like to test boundaries, and if the boundaries, like you mentioned earlier, that let's say going to bed or not going to bed, or for example, not coming to eat dinner at or other things, right? So the children always often like to push boundaries. How can they be impacted if the parents on their end are very unclear and do not enforce their boundaries? How can that impact these children in the long term?
Yeah. So, I mean, for one, well, in the short term, what it communicates to kids, I mean, kids need boundaries, and kids and teens, and as they develop, kind of their job is to push boundaries, and our job as parents is to kind of be the wall. And sometimes we have to move it, but the wall is there to keep them safe. And so we want them to be flexible to make some decisions, but within the safety of these boundaries or structure. And so when that's not there, or when it's there sometimes and it's not there others, kids there's not this sense of safety, and they don't really have a clear understanding of what's expected of them and when and by whom. And well, mom says this, but grandma says this, and my dad says this, it can be very confusing for them. And they're kind of just doing this trial and error. Like sometimes I behave like this and have to go to timeout, and sometimes I get a hug. It's very confusing. And so the expectations are not clear, and therefore not really internalized. But some of the long-term consequences for unhealthy boundaries are primarily it's going to impact the way kids relate to others outside of their family. So, overly porous families, there can be a lead to an enmeshment where the kids really feel like they're just kind of this extension of their family, and they don't healthfully separate and individuate from their family. They don't question things. They don't really develop autonomy. And that can be one problematic thing, because we want kids to kind of grow up and become themselves and, decide what values and principles from us that they want to carry forward. But then the overly rigid, there's a saying we like to pass around here, and it's rules without relationships equals rebellion. And so long term, if it's just like, this is what you do, this is what you say, do it because I said, then we really lose the relationship, and our kids are going to comply to avoid consequences rather than because the relationship means something and they understand why they're doing something.
Well, it affects a lot the internal maturity and motivations. And it sounds like it will also cause a lot of anxiety type of disorders as well. Or
Absolutely. Absolutely. Anxiety or acting out later on.
Yeah.
Yeah.
Now, thinking of family atmosphere and dynamics, what are the signs and symptoms of a family with healthy boundaries? How can you tell?
Well, like I said, it's not always black and white. Like every family I see has certain, and including my own family and probably even yours,
Oh, yeah.
Maybe yours is just perfectly healthy. But we all have our strengths and weaknesses, and under pressure or under stress, sometimes we regress. And so it's really important for us as parents to know our own tendencies and to reflect on kind of why we are the way we are, and why does it feel bad for me to say no, or why am I so likely to feel so strongly about my kid always doing this a certain way, and what is that about me? So it's important to kind of keep that reflectivity. And sorry, I'm losing the exact question.
I think that's really actually really important, because what you're saying is that the question of boundaries actually triggers a self-reflection. What are my boundaries, and what am I expecting from children, and why? And
right.
Some of it may be reasonable and some of it less reasonable. That is just
right.
because I grew up in this environment and I'm always afraid of this thing, right?
Right. And to get back to your question, I remembered it. I got a little bit off, but what do healthy boundaries look like? They look like open communication. They look like, our family really they look like predictability and routine, but with flexibility and with some room for discussion. So, generally kids wake up at this time and this is what we do. And we put on our school clothes, even if we're not going to school. And bedtime is, within this 30-minute period, and we read books and we play, and they have school time and friend time. So there's kind of predictability and routine, or rituals and rhythms to healthy family structures, but there's also consistency in the way expectations are enforced, and especially when there's two parents in a household, or more caregivers, there's at least a general sense of consistency across them, and there's like clear boundaries between generations. So like there's the parents who are serve as more of the authority figure, and not so authority, not like a military, not that kind of authority, but they are the authority, and they work together to parent below. And there needs to be consistency. So a lot of times unhealthy boundaries look like, one parent kind of, and because of their own histories, and again, no judgment, they end up kind of undermining the other parent. And so kids get kind of like put in this triangle of like, I'm going to go to mom, or I'm going to go to dad, or I'm going to go to, grandma, because that's how I can get things met. But when things are clear across the top, a lot of times we see behavior and consistently reinforced, we see problematic behaviors decrease a lot and pretty quickly.
Yeah. Now, I want to remind our audience that you can post questions in the chat box. We're not taking live questions just to keep attendees' privacy, but at any time, please put your questions in the chat box, and we'll try to cover as many of them as possible. This is a big topic because, again, I'm thinking about a lot of the issues that, you talked about, multi-generational families. So that brings issues. And then again, we're in San Antonio, so our different cultures. So the boundaries that might be enforced in the culture that, for example, in a Hispanic family, will look different from the boundaries that the children will experience in school. So this brings a level of complexity, of course, that a lot of parents have to deal with. Now, one question I think is important is age level. And so what would you say are some of the key boundaries that people should think about at different age group for different age levels?
Right. Yeah. So, I think it's pretty obvious, but, younger kids need a lot more of our kind of efforts and structure. They demand more from us as far as boundaries go, because things as basic as, this is when we eat lunch, like they need us to provide kind of a structure for their day, and boundaries of, hands are not for hitting, this is how we can say we're really upset. So there's a lot more younger, and hopefully the goal is kids age or go work through their development, they become more autonomous, and so those boundaries and structures become more internal. And so whereas with a 4-year-old, we're having to like sit down and let's practice our letter cards or whatever, let's go over these. Hopefully with our 14-year-olds, there's more of it's time for me to get on this class. But the boundaries for, like, as parents, we're going to have to monitor different things. So maybe the social and/or online stuff becomes a lot more important for us to. We have to monitor that with little kids, but they're generally not as interested or as vulnerable to some of the stuff that older kids are, just because of the content that's out there. And so we're going to want to monitor some of what they're exposed to and who they're spending time with, and what they know or think about certain things. And again, we want it to be boundaries, but we also want it to be in the context of a conversation. And there's certainly individual differences. Some kids, because of their unique needs, will always require a lot more structure. And some kids, just because, their temperament doesn't really pull for as much and need for that. So it's also important to kind of recognize the temperament of our kids and ourselves to provide them what they need.
Yeah. You know, it's not like the younger age is critical though to kind of establish some of those core habits, uh,
Yes.
and that can be difficult. Again, like you said, I mean, for our children were very different. One of them was very compliant, the other one was less, and so
Right.
it really there was needs to adjust. How, you know, if you think of a family that is trying to make changes in this area, right? What would be your advice? How do you engage, or how where could they start?
That's a great question. So one, I think, be gentle and be compassionate with yourself. That's so critical. Big changes do not happen overnight. And there's a reason that we are the way we are. And so I think the first step for parents who are wanting to kind of make changes is, number one, reflect on the way things are and consider, why they are that way and what is the meaning behind that. And think about maybe what you might have needed as a child when you were a child and your parents maybe were one kind of way. And think back. And then really kind of define the values and the areas of your life and your parenting style that you want to work on, and start small. We are not going to go from being, kind of really lax to really structured overnight. And that might not even be the goal, but just small steps, and be open and talk to the other caregivers and or friends in your community. So be gentle, start small, and reflect. Those are my kind of key things.
And how do you, so thinking about, you know, persistent and consistency, you know, are being critical, you know, what do you say to tell the parents so that they don't get discouraged? Because you get make a change and you start and it goes
Yeah.
well and it goes back.
So the thing we know about that, and I always think about like toddlers, because it's just their behaviors are generally louder and bigger and really kind of can be really frustrating. That's not to say that some teens there's not that as well, but it looks different. So with kids who are having a tantrum, and we're doing our best to try to help soothe them, and we've tried all these different ways, but they just really want to do whatever thing they really want to watch their tablet even though it's bedtime. They're going to tantrum. If we end up giving in and or kind of dropping our boundary there and say like, okay, whatever, what it's going to do is reinforce that, oh, if I just keep crying or if I just keep putting up a fight, eventually I get what I want. And so, but with consistency and persistence, just, and without personalizing it too much, because I know that's really hard. Just, no, honey, I care a lot about you, and it's important that you get sleep. So it's time to go to bed. Over and over and over again. Eventually, it's going to get worse before it gets better, but eventually it's going to get better. I promise. And as long as there's consistency and persistency, then eventually it's going to be eliminated. And we call that kind of phenomena the extinction burst. So before behavior changes, it gets worse.
Yeah.
So stick it out through the extinction burst, man.
Yeah. There's this last fight, you know, the last battle on that a habit that you're trying to implement. We got a lot of questions, so I want to ask you. The first one here is, what do I do to motivate a child or a student to continue school?
Wow. Well, that's a really hard question. One, right? Yeah, and I'd really want to understand more. It's hard to give just like straightforward general answers to general questions because we lose a lot of the context. So I'd really want to understand, what's getting in the way of a kiddo doing well or participating in school. Because a core value we have at Clarity is kids really do well when they can, not when they want to. So when kids aren't doing well, or they aren't aren't feeling motivated, what's getting in their way? Are they feeling overwhelmed? Is it the work is too hard and they don't understand? Is it, what is it? Because I think then the interventions look differently. So I think what do I do to motivate is understand what's getting in the way. And if we can't do that on our own as parents, then that's maybe when it's a good time to kind of ask a professional or get some outside eyes and, try to better understand.
Yeah, that's the beginning of engaging a child is really listening and trying to understand what is the lack of motivation. And they're not always very clear even for the child. That's where maybe professional help can be of good help.
Right.
One other question is a parent who's asking their daughter seems to have tons of homework. She's in the pre-AP classes, and she has to study late every night. Creates a huge challenge with anxiety and sleep. Any suggestion?
Oh man, that is really tough. Again, hard to answer a general kind of question with a general solution, but a couple things come to mind, and one is, assess expectations. Are we studying? Are we being overly perfectionistic? Is there some self-care has to be a priority? It's so critical, and getting enough sleep and exercise and eating nourishing foods is just as important as getting good grades, right? And so is our balance off? Are we overly focused about bringing a 90 up to a 98 whenever we could be focusing on getting good sleep? What is the expectation, and how can we be a little bit gentle about it and still do well? One. And then two is maybe work with teachers. I don't know if the virtual work is more than it was in the classroom, and collaborate on ways like, be clear with them, because I know teachers are doing this for their first time too, and so they may not really understand how much time is having to go into getting things done. And then if a kid, you have to really consider the individual needs. And for some kids, a full pre-AP curriculum is not going to be helpful for them because they're going to be too overwhelmed. For other kids, it's not as big of a deal, but sports might be overwhelming for them. So really kind of consider the kid you have in front of you and what they need. And
see also maybe how it impacts their life, this intense rhythm. I mean, some kids might be able to do more intense work than others and be okay, and then some kids they'll have a terrible social life, or have other issue come up, right?
Right.
Like, wait, this is
exactly, the whole child really matters. So there's the academic and the social and the physical and all of those things, the spiritual. For some families, we really want to nurture all of those things and kind of have some balance.
Now, I have another very interesting question. It's a case of two parents who try to reestablish boundaries when they've been inconsistent, like we were talking earlier, and it's case of maybe even divorced parents with the teenagers who has a diagnosis of DMDD. So that's a complex situation, in other words, right? And again, you probably can't provide very specific, but generally, how would you engage with these parents, and what can they look at and think about?
Yeah, so I think number one, my thought would be, and this is such a sort of common scenario I think we see in our clinics. And so I think my initial reaction would be to really kind of want to sit both parents down, and kind of co-parenting would have to be a big thing. So we have to get the consistent and clear expectations discussed. That would be, I think, my first point, because kids, especially kids that are more vulnerable to mental health concerns or emotional difficulties, they need the structure and the consistency even more so. And so I think that getting all the caregivers on the same page would be the very first and maybe most important step.
Excellent. Another parent is a single parent, and she has 4 children, age range from 7 to 17. So there is a lot of different challenges there. But how can she, and the teenager seems like it's pushing boundaries more than the younger ones. So what can I remind myself of to stop giving away the authority that she has?
Yeah. That's really hard. So I think one is remind yourself why your child needs authority, because it is a need. It's a developmental need. So they are, probably more independent than the youngsters, but they still need a parent. And so you're doing this in the service of your kid. You're not being mean. You're not being, whatever the stories are we tell ourselves. They need us to be an authority figure. They need that role in their lives. But also just recognize how much is on your plate. A single mom of 4, wow, that's a lot. Or a single parent. I don't even know if you said mom. But a single parent of 4 is a lot. And so really kind of, give yourself a pat on the back and give yourself some compassion, but then remember that they need me to be an authority. They need a parent and not a friend.
Yeah, that's the key. Now, we're actually unfortunately out of time, but thank you, Dr. Lawson. This was really important, I think, and there's a lot more to explore about that. Actually, our conversation made me think of a book that I read, and I would like to recommend to all parents. It's just The Essence of Raising Life-Ready Kids. It's written by Dr. Michael Anderson, and he actually spoke at one of our conferences, and that's how I found out. We have a video of him speaking on our website, but very excellent book. GIST is the name of the, if you Google that, GIST book, you can find reference on that. So any closing word, Dr. Lawson?
Not really. Keep doing what you're doing. We're all in this together.
Thank you. Great. Well, thank you very much. And we will continue this webinar series next week with Dr. Jeff Gentry, who is going to speak to us about assessments and some of the assessments that are available online, and what does a good assessment look like. So thank you very much, everyone, and see you next week. Thank you, Dr. Lawson.